Our guest this morning, and we of course want to continue the conversation. Let's just begin with the biggest story, of course, which is the coronavirus threat right now. That is a security threat, so to speak. And we've had that particular pronouncement from the Africa CDC health official, that is Joseph Nkengasong, from announcing that from Ethiopia. Maybe it will just be fair to begin with you, Ambassador Mwencha, so far, because this is related to, the African Union as well, with this particular threat, scaring at us. What are the remedial measures so far? Are you happy with, the turn of events so far, as far as making sure that we contain this particular coronavirus?
Yes, Depal, thank you very much, and good morning, viewers. This is one of the most scary outbreaks that the world has witnessed in recent years. We have had MERS, SARS, Ebola. This is the level of Ebola, if not even higher. And so, first of all, I think from where the outbreak started, one province, you can see what China has done to contain the population, to have immediate intervention, to build a mobile hospitals, and so one would say, if there was a country that would be able to contain this kind of thing, it's China, and they're doing their best. But of course, you don't know how big that has already spread, because scientists tell us that it takes about 2 weeks for it to incubate, and by the time you detect, it is already spread so far. So we are at the early stages. We don't know what's going to happen. I think the question you asked about, say from the African point of view, I'm so happy to see Joseph move that fast. I am very much aware, in fact, was very much involved in the setting up of this Center for Disease Control. It came on the heels of what had happened under Ebola, and we had to seek support of international community to have a facility that is able to detect and help the countries. One of the key things that this center does, for instance, and actually is modeled along Chinese Center for Disease Control and the US. This same gentleman, in fact, we poached it from the Center for Disease Control in the US, is to be able to, the CDC has antennas to the clinics. In fact, if you go to China, I went to the Chinese Minister of Health office. He has a situation room that can tell him what has happened in the most local place of China, that they will know what has happened. And from there, and then they can see this is an unusual pattern of a disease, and so you send intervention. Then you get your samples and test them. And once you discover this is an unusual thing, you then try as much as possible to contain it. This is exactly what the CDC Africa is also supposed to do, because diseases don't know boundaries. And Africa doesn't have capacity. You saw the case of Ebola. Countries have different protocols of intervention. So you need the capacity, first of all, to detect that something has happened, get the necessary, and also share resources, because, for instance, in testing Ebola, we didn't have this facility in Africa. You had to send the samples abroad. By the time you get your result, the disease is spreading. So you have capacities that you can share. So yes, this is first of all detection, be able to support countries on protocols on how you intervene, but also be able to have capacity in terms of resources for testing and the rest. And I'm happy so far what they're doing.
You're happy so far. But you know, the information really coming to hand right now is just about that particular girl from China who now has been quarantined at the Kenyatta National Hospital. But we have cases of illegal, you know, immigrants from China as well here in this country, right? So many of them. Do we have a cause for worry? Because some of these people also have not been screened and they're living amongst us as it is right now. Let's just begin with you.
So I would be careful to move the conversation very quickly into an anti-immigration, anti-asylum space, because I think that's probably where most of the conversations move, and then we don't get back to this issue as a public health, you know, management issue.
Yes.
I mean, what's remarkable about the coronavirus in some ways is the speed at which the Chinese state has moved to basically quarantine up to 20 cities. And it's something like 56 million people are effectively under quarantine. That is, of course, much bigger than Kenya. So one is able to see how when a state moves quickly, it is able to deal with this issue decisively. I think the other point that I wanted to raise on this is really that the Ministry of Health have moved quite quickly also to start to talk about I guess the protective measures they're putting at the airport. And I think that's probably where we need to keep the government accountable, is that they do not allow people in without screening. The other one is really to provide protective gear for our health workers so that they do not come into contact with this, because as we know from this virus, from this particular epidemic, there is no vaccine. So the best thing is to prevent people from catching it in the first place.
All right, let's hear from Dr. Hassan Kalenja.
Yeah, I think, you know, just based on reports that are actually coming out, it looks like the problem is much bigger. I think academics from the University of Hong Kong are estimating about 40,000 people actually having been infected. That is about 1,400% higher than the official record. But this should also, I think, call us to attention to the tendency for some of these viruses to leave their labs. Now, it became apparent that the SARS virus actually came from the National Institute of Virology in China. And lots of reports are also saying this one came from the Wuhan Institute of Virology in China again. And the fact that such viruses, because that institute has actually been working on it for the last several years, and that can be allowed to escape, and some of them which were actually man-made, then they become a problem where we don't have a cure or vaccine to. It's extremely dangerous. I think scientists, I think, should take precautions, and governments to ensure that such things don't leave the labs, especially when you actually don't have a cure to it. You know, we cannot be guinea pigs forever. You know, it's just not safe. Now, for a country such as ours, I agree with my colleague that the best thing we can do is ensure that people have protective gear, but we actually screen people who are coming through the airports, because mostly, or most likely, people who are going to come from those areas are going to come through the airports. But then we also need to make sure that actually the airport staff and personnel are protected so that they don't get exposed, to this virus. I think it's a public health issue. We should manage it. But even internally, within our own labs, what we do, we should be able to guard and to make sure that some of those things people are working on, scientists actually don't get out. Because there's overwhelming evidence right now to suggest actually those things came from labs in China.
So the issue of biosafety as well is very pivotal as it is right now. Let's hear from Brigadier.
Yes, for me, I want to look much more at the security side. And in this respect, first, appreciate the actions of the port health authorities, our own port health authorities. They were able to act so fast and pick out this case. I know it is demanding for those who are coming to the country, but it's just fair that all those coming in cooperate with our own port health authorities. It's good to know also that in terms of Africa, the Center for Disease Control has come on actively, set up the emergency center, and therefore able to report these incidents as they come in. In terms of China, yes, very good action. The quarantine of 20 cities is very commendable. They're working very hard over time to control, and this is very commendable. On the international scene, the International Health Organization, regulation rather, has also come on board to say that they are monitoring what is going on, and that they have three key responsibilities. One is to ask member states to report every case. Number two is to build capacities. And number three is to demand that action be taken when required. They come under the World Health Organization, and therefore you can see that all the respective institutes dealing with this both locally and internationally are active trying to control this coronavirus.
Right, thank you. Dr. Mustafa.
Yeah, Dibal, this kind of virus just popping out like that is not accidental. There was the SARS virus, HIV and AIDS, and others. And I know the initial report is stating that the virus could have originated in a seafood marketplace because of illegal trading in wildlife. In itself an indictment to men and women doing illegal activities. But also another plausible explanation is the one that Dr. Kanenji has given, that the Wuhan Institute of Virology that has been working with this kind of experiments. This could have just escaped from the institute, and if it indeed it did, it would not be the first time that this kind of a virus is escaping from a place where biological weapons, if I could use that word in this case, it's been done. There are so many, there is precedence to this, the use of biological weapons by state actors, mainly actually, in the First World War and the Second World War. And Bill Gates just said last week that the world should prepare itself for an epidemic that can claim up to 30 million lives in 6 months. And I hope that the authorities, particularly the state actors, are watching this kind of development very keenly. If this kind of technology can get into terrorists' hands, you can imagine the kind of damage they can cause.
So serious investigation should actually be undertaken on how it escaped, the incubation laboratory, and now it is affecting the public as it is right now. Let's hear from Ahmed Hashi.
Well, about 1,500 years ago, the Prophet Muhammad ﷺ, issued the first law of what quarantine means. And he simply said, don't go there and don't come from there. So I think that the basic law still works 1,500 years after that fact. I don't think anybody should come from China to this country unless the health authorities at the airport in Guangzhou or whatever else they're coming from could clear them to get into a plane and come to our country. When there's an epidemic, there's a responsibility for a government there or the administration there to stop those people from moving from one town to the other, so that the quarantine works. Quarantine works to let the epidemic filter out. But because we live in an age of globalization and airplanes are as ubiquitous as cars now, it's a very difficult thing for airports and governments to deal with. But I think that basic law 1,500 years ago still works today. Don't leave China and go somewhere else when you're unhealthy. And we are not supposed to go to Guangzhou until this thing comes and goes away.
All right, maybe back to you briefly,
Yes.
Ambassador Rasas Mwencha. So this particular announcement from the CDC activating the Emergency Operations Center, how is it meant to work, in the African continent? If you're privy to any information.
CDC has some national centers like Kemri, which are attached to the CDC in Addis Ababa. In fact, there are, I think, 5 in each region, east, west, and so forth. And from each of those, you make sure that they have capacity to be able to address as many viruses as possible. And then below that, you cascade it downwards up to the village level, so that you are able then to monitor and intervene. And of course, the most important thing is information sharing, because then once there's an outbreak, you share that information immediately. Because you can see, for instance, President Xi Jinping receiving the WHO head of state, the Director General. That is a very good, public, acceptance that there's a problem, we need to intervene. And I think this is the posture that countries should take. If you remember when we had the Ebola cases, countries tried to cover it up, not to even accept that it was happening. And the same thing goes with many other things. Hash has mentioned something that we should really, I mean, I don't disagree with Hash a lot, but I only want to caution here that there are protocols that handle specific diseases. We shouldn't go out and bring in, I think Irungu mentioned something about migration, where, for instance, when this Ebola outbreak occurred, our economies collapsed because then we went out to make things very difficult for the population. And I think we should then implement them judiciously, making sure that, yes, we safeguard population, but we don't go out and cause panic. Because even as it is now, the world economy is going to be affected because of this very outbreak.
Right. Of course, and of course, this has really rattled also the global market as it is. You can pick up also the recent copy of the Wall Street Journal, Virus Fears Rattle Global Markets. There you go, and you can see a survivor. No, this is the Auschwitz liberation that also we shall be discussing later in the program as well, the Holocaust remembrance. But Virus Rattle Global Markets, Dow drops 454 points, and crude oil slams as spreading disease spooks investors. That is just the reality on the ground as far as the coronavirus is concerned. So we'd raised the issue of, and I think also you actually throwing caution, Irungu Houghton, as far as illegal migrants are concerned in this country. But if they are still, because we've had cases of them, we've seen the government also roping on most of them, they are arraigned and they're charged. Don't we have a cause for worry for this?
So I think these are two separate issues, and I don't want to belittle.
Yeah, where is the clarity then?
So I don't want to belittle the concerns around, I guess, illegal migration, and that obviously is an issue. I don't think it is a public health concern. I don't think also it's a national security concern. I worry that it be turned into a anti-Chinese kind of xenophobia, you know, that we are so quick to move to, without really an understanding of the facts of this issue. And the facts of this issue really is that China has moved to contain its epidemic. We must move also, I think, under the leadership of the African Union to make sure that we are not susceptible to the, that's a difficult word for 7 o'clock in the morning on a Wednesday. I tried, viewers, I tried. But I think the key thing there really is just to keep the issues separate so that we don't confuse the issue. And they are two separate issues.
Can I add something to that, Debalde?
Sure.
If you see a Chinese man walking down the mall, he doesn't have the disease. I mean,
let's be clear.
I think we should put it bluntly like that. Disease does not look for you if you're Asian or white or black. It has nothing absolutely to do with our good brothers and sisters from the Chinese community who help us in many ways in this country. And it's very important to separate those two. You know, we also, Africans, have our own stereotypes. The Chinese have had a cuisine 2,000 years before we had a cuisine. So if you think that your ugali and sukuma wiki is better than anybody else, you're dead wrong. So I think that you should know that this is a disease, and the disease, the Chinese government is a very strong, powerful government with the resources to deal with this issue. And I think that they're dealing with it. But you know, at the end of the day, that we should also put a proviso is that, you know, all these flus are coming out of China. We had the SARS one, we have this one now. So probably the Chinese government ought to start investigating and say, oh, what is it that per capita, why is it that we have more than our fair share of these flus? And you know, now there is no country, there is no region, the world, he was in Davos just 2 days ago. He was in Addis Ababa just the other day. So the world, you know, is a small village now. So I really think that the Kenyan government and the health ministry should absolutely make sure that every entry point in this country is manned. You know, what they have is a camera like that, which takes the temperature of the person, and the person sees it on the screen. So it shows a red when the temperature is high. So it's very easy to pick up people. You don't have to screen one person at a time. You just have to look at your monitor and it tells you the Celsius of the person's temperature. So that's how they do it at the airports. So I think this is a very serious issue, and the Ministry of Health, I think, has got a grip on it. And quarantine is the best way to deal with this kind of spread of viruses.